and growing.
If I could add a comment, because it is a Chamber of Commerce event, and it's kind of like the air sucked out of the room when you said it's not a growing industry.
Can I leave now?
So if I could just kind of breathe and add a comment there. I certainly don't disagree with anything that you said, without a doubt. But I heard someone speak a couple of weeks ago who said, you know, we're going into what probably will be somewhat chaotic environment in the next couple of years as healthcare reform is implemented and the degree of change that it's going to bring. But he also said, which is kind of widely understood, the greatest wealth is created in times of that degree of change. And you know, having been in healthcare my whole career, I'm really thrilled at the opportunity for other definitions of healthcare provider, mechanisms, companies, businesses that will be able to drive some of that healthcare cost that we all want to come down through a different approach. We are a Six Sigma organization. Six Sigma is a process control, quality, variability control philosophy and mechanism, not typically applied in the healthcare environment. Yet today, we see many of our hospital customers beginning to apply Six Sigma. We see many changes in the services that are provided to patients. So when my annual results weren't really stellar a couple of years ago, my insurance company called me and said, maybe we should have a conversation. They called me 5 times. That's different. And it, I think, talks a little bit to healthcare. It may be not the traditional model, to your point, Tom, but in other versions of how we provide maybe preventive care will still continue to grow, because if for no other reason, there's all these baby boomers out there who are control fanatics. They want to do something, and somebody's got to help them do it. And so I'm a little bit optimistic that there'll still be a whole lot of stuff for us to do.
And that's really the power of information, again, for a lot of the employers in the room today. Information about people's health, easy access to that information, tied with some elements of payment reform that reward healthy behavior and healthy lifestyles, I think ultimately will be the answer. There is a growth in that segment Tom referred to a moment ago of the more informed consumer. And physician after physician who will tell stories about how a patient will come for an office visit who has been, you know, very well educated and has done quite a bit of research on whatever their health ailment or disease happens to be, and is in a position to have a more intelligent discussion with that healthcare provider, that physician, about a care plan and proceed. Now, there's still again, a smaller segment of those, but I think it's growing pretty rapidly. So the power of information tied with more carrots from a reimbursement or health insurance perspective, I think, is part of the answer.
Well, it's interesting, too, because to key off of the comments all of you have made, I think we are in the process, we society, we the medical profession, we everybody in this room, of redefining what it means to be elderly. When I was going through training, the image of an elderly person was someone in their late 60s sitting in a wheelchair. I think for medical students today, the image of an elderly person is an 85-year-old man who's in their office demanding that they fix his shoulder because he's got the tennis tournament coming up, and damn it, he's going to win this year. I want to ask a question for all the panelists, and I want you to, we're going to key off a little bit on what Joe was showing us before we began the discussion, which is thinking about the future. Where are we going in 2015, which it will put us halfway through the decade? How will your organizations be doing things differently? And Tom, start with you. What do you see Mercy doing differently in 2015 than we are today? And I would also ask you, what are the things that are going to be different that we as consumers and customers of your services would notice?
Right. Well, along the themes that have been mentioned already, it's better care, more accessible care, more coordinated care is what everyone is expecting and demanding. health reform, some elements of health reform will move us in that direction. And I believe there's a lot of excitement and hope around creating these accountable care organizations that pull providers together in a coordinated fashion to take care of a certain segment of the population, whether it be Medicare patients or what have you. I see us leveraging that investment that we've made in physician practices, taking advantage of other elements of the healthcare delivery system besides just the hospital. That system in 2015 is not a hospital-centric system at all. It's a patient-centric system. Not much care, so much care takes place outside the four walls of a hospital, so reaching out to other providers, ambulatory care, physician offices, you mentioned pharmacists earlier, ambulatory surgery centers, all part of a coordinated network of care held together by the glue of a sophisticated information technology system, accountable, transparent. These are all parts of what we hope to help create throughout Mercy Health Partners throughout Greater Cincinnati. And we have a head start in that direction just by the geography and the number of hospitals and outpatient facilities that we have scattered throughout the tri-state, at least geographically, puts us in a position to offer care to people that live in many communities throughout Greater Cincinnati.
I'm going to put you on the spot real quick. You said it's going to be a patient-centric organization. Does that mean I'll be able to come to a Mercy facility on a Sunday afternoon and get a routine service done in 2015?
Oh, yes.
All right, you heard it.
Yes.
I'm writing that down.
I think
and I'd also like to remind everyone that we have cards on the table. If you'd like to write down questions for the panel, write those down, hold your hand up, and they'll be collected, and we'll have a chance to take those questions. Well, so Maria, 2015, what are you going to be doing differently, and how will I, as a customer of Quest, notice that?
There's a variety of things that I think we're putting in place today for the world of 2015. We are a very focused organization. We know where our competency lies, technology, laboratory information, information systems. What we provide is information. What I see for us in the future is to be an enabler for that broader organization, the Accountable Care Organization, to enable them to optimize that care model. So as someone said to me recently, you've got your core competency, I have mine. How do we join together to facilitate that? And so as hospital systems and the network of physicians and hospitals group together, what is the optimal arrangement where we who do labs and information can really bring that with the utmost quality and cost efficiency. I see us being more accessible, so we have many outlets today for the patient. We call them our patient service centers. I see us having more access points for patients because they want to be whenever I want it. I was reading something the other day about the availability of companies that will diagnose and answer patients' questions. Ring-a-Doc is the name of one of them. They are a reflection of patients wanting now answers, not, to your point, 2 weeks from now. So we are doing things like enabling patients to get that kind of information and working with our customers to, in a loop, enable that. We just launched a product about 2 months ago called Gazelle. The Gazelle product is an application for a smartphone on an open platform, and it allows patients to have their medical information on their smartphone. So wherever I go, whether it's the Mercy site on a Sunday afternoon or when I'm on vacation and one of my kids calls and has a problem, I have the medical record, I have the meds. For that sandwich generation that is taking care of the kids and taking care of maybe mom and dad, I can have everyone's records there. I see us being a provider of that information in a way that helps patients. And we believe if we help patients, we help our customers, the physicians. So one of the apps that's being developed is the ability to, when I go out to eat at a chain restaurant and I'm a diabetic, look to see of this menu, what were the best choices for a diabetic to make. So I see us having broader access, broader connection that comes as a result of catering to that evolving patient demand, as well as facilitating that accountable care organization. How do I bring my piece to the table so that you can bring your expertise to the other part? One of the comments made previously related to Cincinnati, and I'm relatively new in Cincinnati, and I will tell you that it is an unusually rich healthcare environment. It doesn't always work this way every place else in the country, from the availability, access, from the collaboration. It's an interesting dynamic in terms of the many health systems that work together, compete, and sort of find the balance, the collaborative in Cincinnati, and information exchange. Medical home, I think we were only one of 2 cities that had multiple medical home pilots going on. So it does set this region apart, without a doubt.
So when you say you're relatively new to Cincinnati, that means you've only been here 20 years.
Yeah.
Bob, 2015, what are primary care physicians going to be doing differently?
I've only been in Cincinnati 5 years, so I haven't arrived yet. Well, you've got me identified with UC, so I had 3 answers already. So in 2015, both the football and basketball teams will have winning records in the same year. 25% of UC medical school graduates will go into family practice, internal medicine, or pediatrics because they identified that that is where the demand for physicians is, because Tom's system and all of the others to make this successful transition to an accountable care organization have to have a strong primary care base. And so rather than that being the least attractive specialty area, it's going to become the most attractive specialty area because all of these other subspecialty areas are now overpopulated and there's no place to practice. And 80% of the primary care practices in the Cincinnati area will be patient-centered medical homes.
So Tom, 2015, from your perspective, say from P&G, what is P&G going to be doing differently for its beneficiaries, its employees, to help them do a better job of being thrifty but also staying healthy?
So let me talk from both a business and an employer perspective. So we just spent a good chunk of the last year looking at 2015 to 2020 and saying, where do we think healthcare, and maybe to put a little air back in the room, we see a lot of areas of healthcare that will grow pretty significantly. Some we're going to play in, some we won't, but some of the ones that are going to grow a lot include condition management and prevention of worsening outcomes for those conditions. Diagnostics. We think that consumers as well as providers want more real-time information. They want, there's also the motivation to improve. And just like we were talking earlier with doctors, patients as they measure will want to improve. Consumer products as a whole, consumers are more engaged. As a result of that, they're buying more, taking more care of themselves. We see tremendous growth in that area. We also see services where basically there will be a democratization of healthcare. It will, things that used to only be done in the doctor's office will be done at a pharmacy. Things that were done at a pharmacy will be done in a home. Diagnostics will be in the home. It will be more integrated. So we think there are going to be a number of services. Also, right or wrong, one of the things that comes with shortages is tiering. And we expect there will be some tiering in the healthcare area, and this group who wants more and more active, more engaged, will pay for more. P&G is playing in that area right now. We are working with a group of network of almost 300 physicians around the U.S. who are focused on providing in-depth preventive care with much smaller practice sizes to this group of highly engaged, proactive consumers. Areas we won't play but are going to grow too include technology, information, technology that will enable better outcomes for surgery, for diagnostics, for radiology. So there are many, many areas that will grow because it will all lead to this improved outcomes. Now, as an employer, we several years ago switched from a cost management to an outcome management. We realized our employees were no better than the average U.S. population in terms of health, despite all the money we were spending. And we also are maybe unique in that most of our employees stay with us not only for their careers, but through their retirement, and we pay for their health care the entire time.